Hi, everybody. This is Dr. Wright, and I want to share 3 secrets to varicose vein treatment costs. I wish everybody knew. So secret number 1 is cash flex spending. HSAs can save you a bundle of time and money. You don't have to go through a lot of hoops that insurance companies put in the way to deter you from getting vein treatment if you're using HSAs or cash. And I'll get into that more. Secret number 2, hospital-affiliated vein practices cost more. They add extra charges and their costs are higher, so they can. If you're trying to save money, you're better at a outpatient vein practice. And secret number 3 is your convenience and time matter. So your vein care can be done all in this one visit with an office, ultrasound done in the same room. You don't have to go down hallways to through a hospital to get it. You can have the visit with the doctor on right at the same time, and it can all save you time and extra actually extra costs. So a little background, vein treatments have changed. They used to be performed in a hospital setting, often required a hospital stay. Now they can be safely performed outpatient. There's minimal downtime. The procedures are smaller. They're done with a local anesthetic, and you go about your business same day. Insurance coverage has changed dramatically. It used to, insurance used to cover whatever, if you had a doctor bill, it covered it. Now, you have to go through strict criteria. They decide what's covered, what's not. They decide what treatment is needed, what's not. And these eligibility things can create a lot of extra visits, and I'll get into that more. Previously they would, your word was taken for. Now, if you're doing conservative treatments with compression, now this has to be documented, and there's less procedures covered. The copays are higher, and the covered services, ultimately are decided by the insurance company. How could paying out of pocket actually save you money? At face value, it doesn't seem to make sense, but insurance requires many steps and that cost you each time a copay, each time they go towards a deductible, extra visits that then also go to the deductible, extra ultrasounds. And copays and deductibles keep going up. Insurance premiums go up, but also the copays and what your portion of it. The average patient copay is $50, sometimes as high as $100, and deductibles, average deductibles over $1,000, sometimes $2,000, $3,000, even $5,000. So it really pays to be smart about this. So insurance companies now require a visit to prescribe the compression. This compression prescription for compression stockings have to be documented. Then follow up to document the use. Each of these are visits. Each of these costs a copay for you, and go towards your deductible. These visits are unnecessary. They take up your valuable time, cost extra money. And they're there to deter you getting the treatment. Also the pain. The symptoms have to be enough that they're substantially interfering with your work and life. But even asymptomatic veins can cause harm. They increase your risk of blood clots and leg ulcers. So this kind of gets into the meat of it. So if you're going through insurance, your initial office visit, you'll have a ultrasound and the prescription for the compression that'll start the clock. Now, most insurances require 90 days of compression use, but there may be a follow-up at 45 days to document your use. And then at 90 days, you come back, get reevaluated, have to attest that you're still having the symptoms because this this trial of compression really doesn't cure anything. It was just there to deter you from getting the treatment, take up your time, cost you extra money. And then we submit for the procedure. And if it's approved, that has to be done at a different day. There's a copay and then the procedure. Then there's follow-ups. Now so it's usually multiple procedures required to completely treat the veins on one or two legs. And each of those additional treatments then has to, again, be approved. There has to be another follow-up visit to document the need for it. All that can add a lot of visits. It can spread out, 8-9 months before you finally get your veins completely treated. Lots of offices, lots of copays. Remember, so your average copay, you're $75 in each of the time. If you're going to meet all your deductibles for this, that's how it's set up. Now, going out of pocket, it's much simpler. It's 3 to 5 offices, the initial visit to determine what's needed, and then a procedure and a second procedure, and then you're usually done. And so there's saves you a lot of time. And in the end, you're probably the cash price, is probably going to be less or equal to what you would have gotten, what you would have gone through with your quote unquote good insurance. So that's how it can really save you time and money, just going out of pocket. Well, I hope this was some help to you, and we're happy to work with insurance. We do we work through people's insurance, and I'm not saying, we're still happy to do it. It's just that sometimes it actually makes sense to use an HSA or cash, and it saves you time and money. But if it works out for you to go through insurance, we can help. We can do that and work with you, and we're happy to do that as well. So whatever works best for you is what we want. And so thank you for your time and attention, and wishing you all the best of health. Thank you.